Bringing your baby home can be an exciting time, but also there are some challenges in learning how to form a routine for you and your new baby. So let's get into some of the things that first-time parents are concerned about. Let's talk about diapering. Your newborn baby will go to the bathroom frequently throughout the day. Their first couple bowel movements will be what's called meconium, which is a sticky, black-like substance that's in the intestines during pregnancy. So that all has to be excreted. After that, if your baby is breastfed, you'll notice a mustardy, seedy-looking stool. If your baby is formula-fed, the stools will be a little thicker in consistency. You should change your baby's diaper often. Make sure that you are cleansing the skin with an unscented hypoallergenic wipe to prevent any sort of diaper rash or skin reactions to the products that you're using. When you change your baby's diaper, make sure that you have all of your supplies with you before you start. You never want to have to leave your baby unattended. Keep one hand on your baby at all times when you're changing a diaper. Many parents can be concerned about their ability to soothe their baby when they're upset. Babies cry for several reasons, especially in the newborn phase. They cry to communicate to you. They cry to communicate their needs for food, for a diaper change. Maybe they're uncomfortable. But sometimes your baby is crying and you don't know how to fix the problem. Maybe your baby is crying and you've fed your baby and you've changed your baby and you've fed your baby again, but the baby is still upset. I like to offer parents some suggestions for how to cope with those kind of situations. And I like to use this list of 5 S's. Swaddling your baby helps them feel secure and snug like they were in your uterus, in your womb. So using a blanket or a sleep sack to wrap your baby tightly can help them soothe themselves and calm themselves down. And then swinging your baby can also help soothe them. And you can use a motorized swing or you can swing your baby in your arms. Your baby is always going to be happiest in your arms. They recognize your voice. They recognize the beat of your heart from the time they spent in your womb. And so that is soothing and comforting to them. And you can combine swaddle and swinging your baby with shushing. So making a shushing noise or using a white noise machine to kind of create a similar sound to what they're used to from the womb can also be soothing. And then holding your baby on their side or on their stomach can help if they're feeling a little crabby because of some indigestion. So babies have immature digestive systems. This is why they get gassy or colicky, why they spit up after feeds. So holding your baby on their left side or their stomach can actually help aid in the emptying of the stomach and help them with like any sort of heartburn or reflux that they might be crabby about. So I like to put the baby on my forearm, kind of face down, and you can combine this with a little back pat and a swaying, rocking motion. Talk to your baby, let them hear your voice, or use that shushing noise we talked about. And then sucking is another way to soothe your baby. So I don't recommend using a pacifier with your baby until you are comfortable interpreting their cues, because your baby might be crying because they're hungry, and we wouldn't want to substitute a pacifier for a feed. Your baby's nutritional needs will fluctuate, especially during that first year of life as they are growing in such huge spurts. And so we want to make sure that we're meeting those needs and not substituting a pacifier for a feeding, okay? And then I would also add a 6th S, which would be skin to skin. Skin to skin with your baby is not just for that immediate after birth period. Skin to skin is like a reboot button for your baby. They love to be close to your skin, next to your skin, hearing your heart, hearing your voice, and just feeling close and secure in your arms. So don't be afraid to use that when you get home as well. As you're caring for and comforting your baby, you want to make sure that you're always supporting their head and neck. Your baby's head is the heaviest part of their body, and their neck muscles are just weak and immature. So you want to make sure that you're always supporting that head and neck area in whatever position you're carrying your baby. If you choose to use a wrap or carrier for your baby, just make sure that it's approved for your baby's age, size, and weight. Newborn babies will spend a good portion of their day sleeping. Your newborn baby may take a 30-minute cat nap or a 3-hour nap. Make sure that you are resting when your baby rests. We do need to talk about sudden infant death syndrome. I don't want to scare you or intimidate you, but it's something that we need to talk about. When I say sudden infant death syndrome, I mean the sudden death of an infant under the age of 12 months. We don't know all of the causes of sudden infant death syndrome, but there are some things that we can do to help prevent it. Don't smoke while you're pregnant, and don't allow anyone to smoke around your baby either. We also should be following some safe sleep practices for our baby. Nothing else should be in the bed with your baby. They should be alone. That's the A of the ABCs of safe sleep. Your baby should be sleeping alone, on their back, and in their crib whenever they're unattended. Your baby should not have blankets, bumper pads, pillows, or stuffed animals in their bed with them. Sleep positioners like wedges that are meant to keep a baby on their back or on their side are also not recommended. Your baby should not be put to bed with loose blankets. You should use a sleep sack to keep your baby warm and swaddled during sleep. Sleep sacks are a one-piece sack that you can use to swaddle your baby during sleep. You'll put your baby in the sack, secure their arms, and then fasten the swaddle wrap around them securely. This is a nice, secure, fitting sleep sack that your baby will not be able to get loose and get over their face and obstruct their breathing in any way. Sleep sacks come in different varieties and weights of fabric for different temperatures and seasons. This is a sleeveless fleece sleep sack with a attached swaddle as well. You should put your baby in their regular pajamas and then put them inside the sleep sack. You don't want to overheat your baby. Think about what you're wearing, and that's what your baby should be wearing also, but with the addition of the sleep sack on top of it. The American Academy of Pediatrics also recommends having your newborn sleep in your room in their own defined sleep space for up to a year to help reduce the risk of SIDS. What questions or concerns do you have that I can address about safe sleep?
What about co-sleeping?
Co-sleeping, that's a great question. So while it is recommended that your baby room in with you for up to the first year, your baby should be in their own defined safe sleep approved space. Things like portable bassinets or the bassinet that comes as part of your portable crib are great options. Also, there's products that allow your baby to co-sleep in a separate space that kind of attaches to the side of your mattress. That would also be approved. But things like swings and car seats are not safe sleep approved for babies. Those are fine to use while you're awake and you're attentive to your baby, but they should not be used for long periods of sleep or when your baby is going to be sleeping unattended. Some general safety tips for taking care of your baby include things like keeping your baby out of bright, direct sunlight or using sunscreen if you're going to be outside for extended periods of time. You want to choose clothing and toys that don't have loose moving parts or strings that could potentially cause harm to your baby. We want to be careful about exposing our babies to lead. If you live in an older home or your baby is starting to crawl around, you want to make sure that there's nothing that they can expose themselves to that might contain lead, such as old toys or painted furniture or even walls that were painted with a lead-based paint. When you're traveling with your infant, try putting a bag or your cell phone in the back seat with your infant to prevent unintentionally leaving your infant in the car seat unattended. Infants can die very quickly of heat exhaustion, so we want to be very careful about this. You also want to make sure that your infant is strapped into their car seat with nothing bulky in between the straps and them. You want no blankets or coats in between the baby and the car seat straps. You also want to adjust that strap clip to be right at the baby's nipple line. You also want to avoid setting your baby's car seat on top of any elevated surface like a table that could be potentially dangerous. We've talked a lot about what it's like to bring your baby home from the hospital, but you're going through some changes too. So next we're going to talk about the postpartum period.